Hi, my name is Christopher Kenoy, and today I'm going to be giving my informative speech. Today, my informative speech is going to be talking about testicular cancer. My specific purpose is to inform my audience about testicular cancer and that each year nearly 8,000 males are infected with testicular cancer. My central idea is that testicular cancer is serious, but also one that can be treated with popular medical care and assistance. Testicular cancer is cancer that develops in the testicles, a part of the male reproductive system. In the United States, between 7,500 and 8,000 males are diagnosed of testicular cancer each year. Testicular cancer is most common among white males. It is not common in men of the African or Asian background, although rare testicular cancer is the most common form of cancer in men between the ages of 20 and 34. A major risk factor for the development of testes cancer is cryptomyocyte, which is an undescended testicle. Other risk factors include inguinal hernia, mumps, or orchitis. Physical activity is associated with decreased risk, and sedentary lifestyle is associated with increased risk. Early onset of male characteristics is associated with increased risk. There are many, they may reflect indigenous or environmental hormones. Before the 1970s, the young man with recurrent testicular cancer was destined to have rapid progression and death from disseminating disease. Currently, although 7,000 to 8,000 new cases of testicular cancer occur in the United States yearly, only 400 males are expected to die of the disease, which is a really good decline. Much of this improvement is due to advances in therapy. Experts don't know what causes testicular cancer, but some problems may increase your chances of getting it. They include having a testicle that has not been dropped down into the scrotum from the belly. This is called an undescended testicle. Normally, a baby's testicle drops down into the scrotum before he is born, or by the time he is 3 months old. This is known as Klinefelter syndrome. This is a genetic problem that affects males. Normally, males have one X and one Y chromosome. Males with Klinefelter syndrome have at least two X chromosomes, and in rare cases as many as 3 or 4. A family history of testicular cancer may increase your chances of also getting testicular cancer. Most men who get testicular cancer don't have any risk factors. They just begin to develop it. Testicular cancer is categorized as being in one of 3 stages. The size of the tumor in the testes is irrelevant to the staging. In broad terms, testicular cancer is staged as following. Stage 1, the cancer remains localized to the testes, which means the tumor is in the testicles and will not spread. Stage 2, the cancer involves the testes and the metastasis in the reproduction and or peritoneal lymph nodes below the urolated diaphragm. Stage 3, the cancer involves the testes and metastasis beyond the retroperitoneal and the peritoneal lymph nodes. Stage 3 is further subdivided into non-bulky stage and stage 3, the bulky stage. Stage 4 is the cancer in the testicles will most likely spread to the liver or lung, the secondaries. The cardinal diagnostic finding in the patient with testicular cancer is a mass in the substance of the testes. Unilateral enlargement of the testicles with or without pain in the adolescent or young adult male should raise concern for the testicular cancer. If you ever had a question or wondered why your testicles were becoming harder or bigger, you should call your doctor and set up an appointment. An incorrect diagnosis is made at the initial examination in up to 25% of the patients with testicular tumors and may result in delay in treatment or a suboptimal approach. which is scrotum incision, for the exploration of the testicles. The differential diagnosis of the testicular cancers requires examining histology of tissue obtained from an iguana or osteotomy specimen. Osteotomy rather than transcortical biopsy is preferred to reduce the risk of spill and thus the risk of metastasis in the event that the tumor is malignant. For osteotomy, an inguinal surgical approach is preferred. The three basic types of treatment are surgery, radiation therapy, and chemotherapy. Surgery is performed by a urologist. Radiation therapy is administered by radiation oncologists, and chemotherapy is the work of medical oncologists. In most patients with testicular cancer, the disease is cured readily with minimal long-term morbidity, which means remaining sexually inactive for a little bit. While it might be possible in some cases to remove the testicle cancer tumors from a testis while leaving the testes functional, this is almost never done, and as more than 95% of testicular tumors are malignant. Since only one testis is typically required to maintain fertility, hormone production, and other male functions, that affiliated testes is most always removed completely in procedure called inguinal osteotomy. The testicle is almost never removed though from the scrotum. An incision is made beneath the belt line in the inguinal area. Most notably, since removing the tumor alone does not eliminate the producing cells that exist in the testes, it is usually better that the long run to remove the entire testes to prevent another tumor. A plausible exception could be in the case of the second testes later develop into a cancer as well. A man with one remaining testicle can lead a normal life because the remaining testes take up the burden of the testosterone production and will generally have adequately fertility. However, it is worth the minor expense of measuring hormone levels before the removal of a testicle, and sperm banking may be appropriate for younger men who still plan to have children, since fertility may be lessened by removal of one testicle and can be severely affected in extensive chemotherapy or radiotherapy if it is done. Less than 5% of those who have testicular cancer will have it again in the remaining testes. A man who loses both testicles will normally have to take hormone supplements, in particular testosterone, which is created in the testicles, which a man might lose if having testicular cancer. After the removal of both testicles, a man will be infertile but can lead otherwise a normal life. In conclusion, testicular cancer is a really serious issue. It can be avoided through surgery or just keeping a self-examination every day or every month. Thank you for listening to my speech, and I hope I raised awareness about testicular cancer.